Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. I'm glad to see you all. First, I want to thank you for all your presence in this moment and today health promotion. Before we begin, let's introduce myself. My name is Nazia Hakim. I'm from nursing class 2C. So, we realize that not everyone knows and have been health promotion regarding cervical cancer. How can this be? That's why we were today to tell you what is in all you may want to know about health promotion regarding cervical cancer. Let's start with how it began. Cervical cancer is cancer that grows on the cell in the cervix. Generally, cervical cancer does not show symptoms at an early stage. New symptoms appear when the cancer has begun in spread. In many cases, cervical cancer is linked to sexually transmitted infection. The cervix is the lower part of the uterus that connects to the vagina. One of the functions of the cervix is to produce mucus or mucus. The mucus helps pass sperm from the vagina to the uterus during sexual intercourse. In addition, the cervix will also close during pregnancy to keep the fetus in the uterus and will dilate or open during labor. Cervical cancer is one of the most deadly types of cancer in women, apart from breast cancer. Based on research realized by WHO in 2014, more than 92,000 cases of death in women in Indonesia are caused by cancer. Of these, 9% occurred due to cervical cancer. Meanwhile, according to data from the Indonesia Ministry of Health, there are at least 15 cases of cervical cancer each year in Indonesia. Type of cancer. Detecting the type of cervical cancer suffered by a patient will help doctor provide the right treatment. Type of cervical cancer are divided into namely 1. Squamous cell carcinoma or SCC. SCC is the most common type of cervical cancer. SCC begins in squamous cells, which are cells that line the outside of cervix. 2. Adenocarcinoma. This type of cervical cancer begins in granular cells in the cervical canal. In rare cases, the two types of cervical cancer above can occur simultaneously. You can take several preventive steps to reduce your risk of developing cervical cancer, including 1. Have safe sex. Use condom and avoid sexual intercourse by changing partners. 2. Receive the HPV vaccine. The HPV vaccine can be given to women aged 9 to 26 years. This vaccine will be more effective if given before being sexually active. 3. Routinely undergo pap smear. Having a pap smear regularly based on your age keeps your cervix in check, so that if there is cancer, it will be easier to treat before it develops further. 4. Don't smoke. To conclude everything we know, that cervical cancer is a disease that is dangerous and deadly for women. It's been a great discussion with you all. I don't feel like we are the one who present, but I did. Thank you very much for your great attention and active participation for this presentation. Wassalamualaikum warahmatullahi wabarakatuh.